Your doctor has ordered the Oncotype DX breast recurrence score test to help inform you of your options for treatment. In this video, we will review a sample node-negative patient report to help you prepare for your conversation with your doctor when the results are ready. You've been diagnosed with early-stage hormone receptor-positive HER2-negative breast cancer. According to the surgical report, the tumor was not found in any of your lymph nodes. With this diagnosis, you will likely be prescribed endocrine therapy like tamoxifen or an aromatase inhibitor. You and your doctor will need to determine if other treatments are needed. The questions that your Oncotype DX test results will answer are 1. The risk that your cancer will return somewhere else in your body, and 2. If you may or may not benefit from chemotherapy. The first page of the Oncotype DX breast recurrence score report provides 3 pieces of information to aid in treatment decisions. The first box shows your Oncotype DX breast recurrence score result, a score between 0 and 100. This personalized result is based on the unique biology of your tumor and helps you to understand 2 important things that will help with treatment decision-making. 1. The likelihood that your cancer will come back elsewhere in your body within the next 10 years if you take 5 years of endocrine therapy alone. And 2, how likely you are to benefit from the addition of chemotherapy to your endocrine therapy regimen. The lower the score, the lower the likelihood of your cancer coming back somewhere else in your body if you take endocrine therapy alone. The higher the score, the higher the likelihood of your cancer coming back somewhere else in your body if you take endocrine therapy alone. As your score increases, the magnitude of chemotherapy benefit also increases. The middle box of the report provides the risk that your breast cancer will return somewhere else in your body within the next 10 years when treated with 5 years of endocrine therapy, such as an aromatase inhibitor or tamoxifen. In this example, there is a 4% risk of your cancer coming back elsewhere in the body. This means that out of 100 women, 96 women will not experience cancer coming back in a different area, and 4 women will develop cancer somewhere else in their body within 10 years if they are treated with endocrine therapy alone. The last box shows an estimate of how much chemotherapy may lower the risk of cancer coming back elsewhere in the body. This percentage is an average for all women within a similar score range. In this example of a woman less than 50 years of age with a recurrence score result of 15, the group average absolute benefit of chemotherapy is less than 1%. How do we know this to be true? In the largest ever clinical trial for invasive breast cancer treatment after surgery, with over 10,000 patients that were followed up to 12 years, researchers found that women with node-negative, HR-positive, and HER2-negative invasive breast cancer with a recurrence score result of 11 to 15 did not benefit from the addition of chemotherapy to endocrine therapy treatment. However, patients with a result of 16 to 20 that were high clinical risk and patients with a result between 21 to 25 who were either low or high clinical risk had clinically meaningful chemotherapy benefit. Additional studies have shown that for women with a recurrence score result of 26 to 100, there is a substantial benefit to the addition of chemotherapy. The middle section of your report shows the quantitative single gene scores of key breast cancer-related genes detected in your tumor sample to help your doctor better understand what is contributing to your recurrence score result. The second page of the report provides more details about your results and shows where your recurrence score falls on the graph so that your doctor can further evaluate your results with respect to the reference studies. That concludes our overview of the report. If you have questions about the testing process or want to learn how the Oncotype DX breast recurrence score test helped other patients with their treatment decisions, please visit our website at www.oncotypedx.com/patient. We wish you the very best in your treatment and recovery.